In cybersecurity, healthcare is playing a losing game, with ransomware attacks increasing over 45% in recent months. That being said, there's an opportunity to basically and fundamentally transform the healthcare industry when it comes to cybersecurity. At CyberVista, we work with healthcare organizations to grow skills that actually strengthen their cybersecurity postures. Do you have a team that could benefit from increased skills and knowledge in cybersecurity? Contact us at CyberVista to learn more about how we can help.
Hello, everyone, and welcome to this special series, HIT Cybersecurity, brought to you by CyberVista for HIMSS TV. My name is Mike Milliard. I'm Executive Editor of Healthcare IT News, and joining us today is guest host Lee Kim, Director of Privacy and Security at HIMSS. And to talk about some security trends for 2021, she'll be interviewing Kevin McDonald, who's Healthcare Cybersecurity Advisor at MedSec, Mitch Parker, who's the Chief Information Security Officer at Indiana University Health, and Michael Wright, Senior Business Systems Analyst at Spectrum Health. And so with that, Lee, I'll turn it over to you.
I wanted to start the discussion off with Kevin and ask about medical device cybersecurity. What's going on with it today, and how has the COVID-19 pandemic affected it? Kevin?
Both healthcare delivery organizations and manufacturers are continuing to mature. There's a real realization of the problem and the issue now, and it's great talking to customers or HDOs who actually have things like medical device security on their enterprise risk management lists, which is a big step. What I'm seeing though now is a much more of a have and have-nots. If you're a large institution and if you had your program fairly well underway, you had a lot of your tools bought, you're able to continue that, albeit a little bit slower now. But if you're not, a lot of the HDOs are really having difficulty ramping up. And it's really two things that are causing it. One of them is just a focus. I mean, quite frankly, as we all know, there's a ton of stuff going on. You're trying to push out your telehealth stuff. You are recruiting people to, take temperatures as the doors. When people come in the doors, there's just that huge amount of other work. And so that's delaying it. And it's a financial thing. There are a lot of institutions which are just hurting. So for them even to start buying tools to be able to do things like get an inventory is very tough right now.
And Michael, I'm sure that we've all heard about telehealth vastly increasing, but from a provider perspective, could you please tell us what's going on with telehealth now, especially during the pandemic, and how you're battling challenges with that in regard to InfoSec?
For telehealth pre-pandemic, for most organizations, they were still stepping their toes in the waters or had some sort of strategy to grow that program 2 to 3 years out. When the pandemic hit, you take that and you shrink it down to weeks and months. From a security standpoint, you have some different factors depending upon large to small size organizations. For the larger ones, if you had an existing telehealth solution, you were going to scale that up to meet the need. And so in doing so, whenever you go from something that was planned for months down to days and weeks, you have inherent risk in that operation. And so you could have holes in your security process that emerge as a result. For smaller organizations, depending upon if they had the available funds, they may have had to go with a off-the-shelf commercial solution, which then puts them at a different security level risk where they are no longer in control of the total solution itself. And on one hand, and then they're working with a solution that does not or is not geared towards healthcare focus. So it presents a host and mixed bag depending upon where you sit within your healthcare realm as to if you're an existing large-scale patient care provider or if you're a specialty such as a cardiology, radiology outfit, and you're relying now on more commercial. So it's been very interesting to see and watch how healthcare systems have wrapped around process around telehealth, because you now have to also factor in this one piece that with a large now influx of adoption of telehealth, you have to keep in mind the hackers are also now watching that as well, and you have a new honeypot of for them to go and try and penetrate.
Mitch, thinking about how, as Michael had said, unfortunately about cyber attackers taking advantage of the current situation during COVID-19, how has securing the human factor changed in your estimation?
It has changed significantly. While we've seen a lot of the same old scams being tried, we've seen them being tried with new angles, and we've seen a lot of existing type scams, such as pretexting, really ramping up, except now instead of the lure of threatening to get you arrested, they now talk about your COVID stimulus payments or your eligibility for a COVID vaccine. So you have to be constantly on the lookout and making sure that your workforce is constantly informed of the latest scams that are out there, and make sure that you're aligned with your corporate communications team so that you could rapidly disseminate what you need to do. So again, you can keep not only your workforce, but also potentially your patients informed.
What's the current environment? I mean, obviously there's more remote work happening. There's more things happening that are dependent upon, the cloud. And so what's your impression in terms of what's happening now vis-a-vis cloud security?
Michael actually kind of gave a good introduction to this question with all of the things that are going on and the increased move to telehealth and increased move to the cloud. There's been a huge increase of network traffic being driven by a movement to some off-prem cloud and particularly the remote work and the remote care. A lot of places had their cloud movement strategy set up. And as Michael was saying, what was a 2 or 3 year strategy turned into a 2 or 3 week strategy. So what a lot of the HDOs are now having is difficulty with setting that up fast and being able to bring their infrastructure, their processes, and their security along behind that rapid movement. So as they move quickly, they have done things like used different vendors, they've used different environments. Their environment has become much more complex. And so they've also potentially taken and made some configuration changes to be able to handle the increased volumes and the increased uses. And so those are all things that if you take a longer time and you're able to do a much more comprehensive type planning, you're able to simplify your environment, you're able to decrease the variation in the environment, and you're able to bring those activities along, like how you're now going to use your SOC. And so right now, as far as cloud security goes, HTOs really are playing catch up with it. Again, some of this is a little bit of, I keep saying have and have nots. If you're a large academic medical center who's always had a cloud strategy and was moving there well before, you're able to manage these transitions a little bit better. Mitch might say no, but at least you have some of that infrastructure and you have the knowledge on what you need to do. If you're a smaller institution, all of a sudden now, and you move to the cloud, you have to build that into all of your processes, all your configurations, and make sure that those stay secure as you go forward. So then, of course, there's still the problem now. This is one more place where we're encouraging a lot of the shadow IT to move some of their stuff as well. And it's much easier to be able to do that for those shadow IT departments because they don't need to order hardware at all even. So there's a lot of movement. There's some catch up and the environment has become more complex.
And Michael, I think that was an interesting perspective that Kevin just brought up. And I wanted to ask your, expert perspective in terms of what it's actually like working with clinicians, many of whom are remote, and also dealing with the shadow IT challenge as well. What are your thoughts?
Yes. First, a thank you to all clinicians and IT professionals out there. The pandemic has taught us that we can support remotely, but it also has made us more aware of what at the elbow support really provides to staff. So it's been difficult, but yet at the same time, you find ways to support your teams. I think everyone's VPN has been tested and hit hard. And so there's many new variables now in supporting clinicians remotely, whether they're at home or at a remote pop-up site treating patients. You have distance factor, you have technology factor, devices, is also a factor. But you work through it. There isn't really a one solution fits all. It takes a team. And it also, again, which is why I said thank you to the clinicians on their side. They had to adapt as well. We're asking more questions because we're not there physically to be able to assess as much. And so we have to ask more probing questions while we're supporting those teams remotely. And at the same time, we're also trying to always avoid the network challenges that are now faced with being a remote team for the most part. Although we do, also still have teams, at many organizations still on site, but the presence is not as large as it once was.
Sure, that's very well said. Thank you. Especially in this day and age, we hear about cybersecurity all the time, but then, there are some folks that may not necessarily want to deal with people in the field thinking that, well, they always add work for me. Why do I need to go through these steps to authenticate or whatever else? Or why do I have these restrictions? What is your advice to those out there in terms of how you can transform your organization where the cybersecurity professional really is trusted, where they're an enabler?
I think the most important thing you can do is listen to your customers and understand their needs. And because you have opportunities where you could leverage security and the cloud in particular to make people more efficient or get rid of processes that they don't need. And you have to think in the mindset of, if you're somebody there just trying to do a job, how can you make it easier for them to do their job? How can you make it so that they don't have to do a whole bunch of extra steps? And you have to be empathic to their needs and what their concerns are, because there's been a lot of security solutions that have been put in place that have really caused disruptions in workflow to organizations. And you have to understand that and work around that. And because I will tell you something, building back again on what Kevin had said before, part of the reason why the cloud got so big in healthcare, and literally it happened when, as soon as cloud came out, it was shadow IT in organizations. They just didn't realize it, was because you could either go through a process that disrupted your workflow or just expense someone's Visa card, and next thing you know, you've got the app that you need. So you have to understand and work around those factors and make sure the customer understands you're there to work with them to ensure their business runs, not to add to it.
Kevin, I wanted to ask you, in wrapping up the session, what are your parting thoughts that you'd like to share with the industry in terms of your observations or insights?
I think the thing as we go forward, if you start looking through healthcare and cybersecurity, is that we have to focus in cybersecurity instead of on the cybersecurity. We have to become much more risk managers. We can't say no anymore. It's going to be, and as soon as we start talking, as soon as words that sound similar to cyber Armageddon come out of our mouth, we lose all credibility. So it really has to be a discussion of what are the institutional needs, what are the institutional priorities, what will it take to mitigate those risks, and making sure that we have a good open discussion about accepting those risks and what does it mean in terms of the benefits. And then we as cybersecurity professionals have to emotionally get over that and move on and not see ourselves as some sort of white knight that is trying to save the institution, because we have to learn, if they want to do something or buy some technology that are going to save a dozen babies next year, we in security are going to lose, and rightly so. So it's now, how do we articulate the risks? How do we make sure that they're consciously accepted? And how do we make sure that we are able to mitigate it as best as we can?
Very well said. Thank you. And Michael, what are your thoughts and insights?
This year has presented, this past year has presented us with a lot of challenges, and a lot of them have been met. You have to take the solutions that have been installed, the processes that we've learned mid-flight. We're sort of changing the oil on a plane, halfway through its journey in some cases, and things that we would never have done in the past. But we found a way to get it done. Some of those processes and steps, the teamwork that the organizations have put in place to mitigate strategy, to shorten time to from product purchase to solution install. Those are all things that we should carry forward.
Thank you. That's a really good point. And Mitch, what are your parting thoughts and insights for the industry?
I think we need to spend a lot more time working with our customers to understand what their needs really are. And again, information risk management is a term I've used over the past 5 years with my customers to talk about how we need to better align with the business. So understanding their needs, aligning with the business, and helping them articulate and define the vision of how they can provide better care is where we need to be at.
Well, thank you, gentlemen. Definitely appreciate all of your expertise.
Well, thank you so much, Lee, for a really terrific and informative presentation. And thanks, of course, to Kevin, Mitch, and Michael for bringing your expertise. And thanks, of course, to you in the audience. This has been HIT Cybersecurity, brought to you by CyberVista for HIMSS TV.
In cybersecurity, healthcare is playing a losing game, with ransomware attacks increasing over 45% in recent months. That being said, there's an opportunity to basically and fundamentally transform the healthcare industry when it comes to cybersecurity. At CyberVista, we work with healthcare organizations to grow skills that actually strengthen their cybersecurity postures. Do you have a team that could benefit from increased skills and knowledge in cybersecurity? Contact us at CyberVista to learn more about how we can help.